Hi, I'm Dr. Josh Vance with Camizo Diagnostics. Today's case of the day was numbness in the lateral aspect of the thigh, known as meralgia paresthetica. So a patient presents with, he's been to his medical provider, and they wanted to do an MRI, but they wanted to prescribe physical therapy first. So he had to go through a succession of that before he could have an MRI for his insurer. So we put him through, he went through PT with very little improvement with it. He did basic things like ultrasound, E-stim, some stretching. But he came to me wanting to know what he could do without having to do something more invasive or having to do an MRI. So when he came in, I essentially examined him, then also palpated the area of the inguinal ligament where the entrapment occurs for the meralgia paresthetica. So what he was having problem with, he was leaning to his side. He was leaning to the side of where he has that numbness or the paresthesia of the leg. And so he was leaning that direction and his psoas was shortened. So I wanted to explain a little bit about why the psoas would be an excellent muscle to stretch for meralgia paresthetica is because it goes through the same area. So here's a picture of meralgia, or where the impingement occurs with meralgia paresthetica. So you can see the nerve comes right through here under this ligament that goes across, and here you have the iliopsoas muscle that goes right there with it. So he had injured himself in extension while he was painting a tall wall, and then the next day couldn't get out of bed and his leg was numb on the thigh. So here is the iliopsoas as it comes through. So I'm going to blow up a picture of that from Camizo. And this is the actual iliopsoas muscle. So what we did was we discussed his pain pattern he was having, which was in his lower back and also having it in his thigh. So I was able to correlate that information just by showing him exactly where the impingement is. We put him on a course of chiropractic adjusting and did a release on his iliopsoas while I was in, and then prescribed those exercises, the specific stretches and extension that look like this. And he started doing those immediately, and within just one night, he come back and he was 70% better. So this is a case of meralgia paresthetica. It's very common. Usually you'll see that these people will notice when they sit, the irritation goes away. Where we suspect that this occurs in extension because he was extending back, and that irritated right there at that ligament with the iliopsoas, and it's a compartment. So you only have about this big of a space. You can only stick so many things through that existing space. Well, the lateral femoral cutaneous nerve is what's impinged on a meralgia paresthetica. It runs right through the same area. So having an irritated psoas will cause that numbness and tingling to the lateral thigh. So releasing that out and doing the proper stretches did him very well. So I hope you enjoyed the case of the day.